polycythemia. This is an increase in the WBC count, hemoglobin and hematocrit. Previously we spoke about anemia where there is a decrease in the RBC count and hemoglobin. Here polycythemia is an increase in the RBC count, hemoglobin and hematocrit, and they are divided basically into two main groups, primary polycythemia and secondary polycythemia. Primary polycythemia is very uncommon and it is usually due to uncontrolled proliferation of your hemopoietic cells within the bone marrow, which cells are the promoting factors for the increased production of RBCs. So this is very uncommon, the primary polycythemia condition. Secondary polycythemia, here more commonly it is caused by chronic stimulation of the bone marrow due to some other secondary condition for the patient. That is, if the patient is a COPD case having hypoxemia, any condition where the patient is having symptoms of hypoxemia, patient with chronic hypoxemia due to COPD, obstructive sleep apnea, pulmonary fibrosis or chronic heart failures, all these patients they will be showing symptoms of hypoxemia, chronic hypoxemia, which stimulates the bone marrow, thereby increasing the production of your RBC secondary to these conditions. Another cause is compensation of low oxygen pressure. That is, people living in high altitude, they are in these cases chronic hypoxemia is stimulating the renal production of erythropoietin, causing the bone marrow to produce and release large amounts of excessive RBCs to compensate the oxygen deficit. Now another cause is heavy smokers who exhibit secondary polycythemia. The carbon dioxide which is associated with cigarette smoking, they bind with the tightly with the hemoglobin and reduces its function of oxygen transport. This results to a functional anemia, which the bone marrow responds by increasing the RBC production. Another scenario is the presence of significant hypoxia due to severe anemia. The maturation time of RBC is decreased, resulting in release of immature normoblasts or immature nucleated RBCs, which are not normally seen in the blood of adults. As a result of hypoxia in uterus, NRBCs are present in the fetal blood and the newborn as well, which appears 3 to 4 days after their birth. And these nucleated RBCs also occur in patients with some myeloproliferated neoplasms. Now, both primary and secondary polycythemia involves an absolute increase in the total RBC mass. Relatively, polycythemia can also be seen in where there is an increase in plasma volume, like in patients who get seen in patients who are dehydrated. This does not present a true increase. It is only a relative polycythemia where the number of circulating RBCs, there will be shown an increase. Although polycythemia is helpful in increasing the oxygen carrying capacity of the blood, it can be compromising the heart and circulatory system, causing increased cardiac workload and increased risk of clotting formation and thrombosis in the circulatory system. Oxygen carrying capacity can increase, but anything in excess, even if it is oxygen, it can compromise your oxygen, your heart as well as your circulating system. The heart by giving it an excess workload, and in the circulatory system by causing clot formations and thrombosis, which can cause other conditions like CVA. So the treatment for this is focusing on the underlying problems caused in patients, which may include restoring a normal HCT, that is a hematocrit, by controlled removal of the whole blood through phlebotomy. So this is the basic treatment for this polycythemia when it is in its severe condition and can cause severe heart and circulatory system compromise.